Hi everyone, we're group 6 and we did our topic on heart attack prevention. We were really drawn to this topic because we've all seen a need for it in our community. I know I've experienced this firsthand because my family is one of the most susceptible groups to having a heart attack and they're not very knowledgeable about its prevention. So we hope that with this project we're able to inform the community and bring more awareness in the Riverside and San-Bernardino area. Now I will introduce to you our team. My name is Lourdes Flores.
My name is Stephanie Becerra.
My name is Ramneek Chima.
This is me, Emmanuel Javed.
My name is Mackenzie Plevny.
And I'm Max Lasarski.
Right now, I would request you all to please fill out our pre-survey. If you do, I'm going to start the timer for a 5-minute period, so you all may start the survey. While you do the survey, please make sure to read our consent form.
Our learning goals for this presentation are to educate on spotting the signs and symptoms of a heart attack, understanding what activities and past medical history increases the risk of a heart attack, and what steps can be taken as a preventative measures to respond adequately in the event of a heart attack.
What is a heart attack? Well, to make it simple, it's just blood going to the heart getting blocked. But the main cause of this blockage is plaque buildup. Plaque can be formed from many things and sticks to the walls of the blood vessels. When plaque builds up on these walls, they can rupture or split from the walls, and this causes a blockage. Now, the much needed oxygen cannot reach the heart, and eventually parts of the heart become damaged. In worst cases, these parts die.
Hello, again, my name is Lourdes and I will be explaining some important statistics. So every year, about 805,000 Americans have a heart attack. And of these, 605,000 have a heart attack for the first time, while for 200,000 Americans, it is a recurrent heart attack, meaning they've already had one previously. About 1 in 5 heart attacks go undetected, implying the damage is practically done, but the person is not aware of it. And the reason for this is because people don't recognize the symptoms, and this is why recognizing the warning signs becomes so important. Patients delay medical care because they don't know the warning signs. Average time from onset of symptoms to seeking medical treatment ranges from 2 to 6.5 hours, which can greatly affect your treatment options. Heart attacks at $12.1 billion was the second most expensive health condition treated in U.S. hospitals in 2013. And if we look at the left side, this graph explains that the average California age for a heart attack is around 33 in San Bernardino County and around 30 in Riverside County. Heart attacks result in 4,500 hospitalizations each year in Riverside County, while San Bernardino County's prevalence rate for heart disease was the highest among neighboring counties and the state. People living in underserved low-income areas are more likely to suffer from a heart attack, making this a very serious problem in terms of health inequity.
Hi everyone, my name is Emmanuel Javed, and today I'm going to explain about heart attack deaths in Riverside per 100,000 people. So as you can see, there are 29.7 Native America Alaska natives, 28.6 Black, 25.4 White, 20.9 Hispanic, 18.3 Asian Pacific Islanders. Now, if we just look at the figure clearly, we can see heart attack is spread in almost every race. Almost more than a quarter of people in an ethnicity suffer from a heart attack. It is time to join hands and prevent heart attack from happening.
I'm now going to explain the heart attack death rate in San Bernardino per 100,000 people. This is categorized by race, and this can be affected by the social determinants of health. Examples of social determinants of health can range from access to healthcare or even access to clean water. As you can tell by the infographic, the highest mortality rate in San Bernardino was at 32.4 within the white race. Up next was African Americans at 29.5, and then after is Hispanic or Latinx at 22.4. After that is Native American/Alaska Native at 21.6, and lastly is Asian/Pacific Islander at 20.6. Even though the two counties are right next to each other, there are different races affected with the different mortality numbers due to the social determinants of health.
Now it's an honor for me to discuss early symptoms of heart attack on behalf of my group, Group 6. So the early symptoms of heart attack include feeling of fullness, pain down one or both arms, shortness of breath, fatigue, nausea, back pain, chest pressure and discomfort, and at last, jaw pain.
There are many signs and symptoms of a heart attack, and they can vary in both men and women. Men receive more symptoms, but the symptoms that women receive are more deadly. For example, men can feel shortness of breath or even vomiting, whereas women can faint, suffer from indigestion, or even have extreme fatigue. However, there is some commonality in symptoms as well. Both men and women feel chest pain and pain in the upper body, such as the neck and abdomen. Sometimes these symptoms can be abrupt, and other times it is subtle. These symptoms can be very deadly, and you may not even notice. It is important to pay attention to these signs and always take into account the risk factors to prevent heart attacks.
Many environmental elements, such as stress, diet, and alcohol consumption, can increase the likelihood of developing major risk factors that can lead to a heart attack. Consumption of tobacco products and fatty foods can increase blood pressure, cholesterol, obesity, and the outcome of being diagnosed with diabetes. But there are also various risk factors we cannot control. One of these risk factors is age. When growing older, we greatly increase our chances of experiencing a heart attack due to our bodies wearing down. Another risk factor that tends to get overlooked is gender. Statistically, men suffer more from heart attacks per year than women. It has also been shown that women suffer deadlier heart attacks than men. Genetics can play a large role in the status of our hearts as well. Some people have hearts that could power a ship, while others can be more prone to heart attacks and suffer more from heart disease.
So here are 7 steps to a healthier heart. As my colleague Mackenzie mentioned, when addressing health risks, there are ways to manage and minimize the impact of certain risks such as cholesterol, blood pressure, and weight gain. Having a high cholesterol severely impacts your heart's health because the presence of plaque in your arteries leaves your heart muscle susceptible to blockage of oxygen. Without oxygen, your heart's muscle may be permanently damaged, so it's best to strive for a cholesterol level lower than 200. Furthermore, maintaining your blood pressure below 120/80 is ideal to minimize the stress on your heart and blood vessels. This can be done by simply following a low sodium or low salt diet and weight loss regimen. Lastly, weight gain and fat can contribute to more stress on an individual's heart, lungs, blood vessels, and skeleton. Although I explained the significance of cholesterol, blood pressure, and weight gain, we chose to address factors that seem to be easier to manage for people of varying ages, such as stress, diet, and physical activity.
If you're witnessing a heart attack, you have limited options to help out the victim in need. First and foremost, 911 must be called and made aware of the situation to send an ambulance your way. After calling, monitor the patient's breathing and make sure the patient is comfortably sitting and leaning forward. However, if the victim happens to go into cardiac arrest while you're waiting for the ambulance, there's still one action that can be performed. If the victim goes into cardiac arrest, CPR must be performed until the ambulance arrives. These are common sequences of events to expect for someone witnessing a heart attack. The message that we are trying to get across is that we as individuals can prevent and decrease the likelihood of having a heart attack by taking care of our bodies. If you do witness a sudden cardiac arrest or heart attack symptoms, the first thing you need to do is call 911. Health risks for heart attacks can all be managed through daily exercise, stress management, and a better diet. Lastly, unhealthy activities such as smoking can also increase the risk for a heart attack, which is why it is important to eliminate risk factors that you can control.
Available now on screen are various resources that we found in hopes of helping our communities of San-Bern-Heart-Dino and Riverside. Heart Care Institute is a community hospital located in the Riverside area. If you suspect you or someone you know of having heart problems, please contact them or a local physician immediately. The American Heart Association is a nonprofit organization that wants to help lower the numbers of people who suffer from heart disease. They offer many free resources on their website, including spotting and what to do in case of an emergency. Feeding America is another nonprofit organization that helps with local food banks. We know that in these times of a lockdown, that food can be harder to come by, so we included this site to help. Million Hearts 2022 is a national initiative to prevent 1 million heart attacks and strokes within 5 years. It focuses on implementing a small set of evidence-based priorities and targets that can improve cardiovascular health for all.
We ask that you please fill out our post survey so that we can better serve our community and its members. In addition to learning more about the community, we would like it if you could take a look at our brochure and read more about the message we intend to convey regarding heart attack prevention.
We are having a donation go on for the American Heart Association. Providing your donations will allow more money to be given to America's leading cause of death, heart disease. Donations will be given to heart disease patients in need and for research towards heart disease as well. So far, we have $225 donated. Please scan the QR code or type in the link to be redirected to the GoFundMe page. Please also visit our website for more resources and information on this topic about heart attack prevention. You can scan the QR code to be redirected. Thank you. And thank you for taking your time to listen to our presentation. And now we have time for any questions you all may have.